Hello everyone, my name is Dr. Casey Howe. I'm an orthodontics specialist. So today I'm going to talk to you about a special form of a malocclusion. We call it anterior open bite. What is anterior open bite? It means that this is upper teeth, this is lower teeth, that when they bite together, they are not in contact. So therefore, if a person is a sandwich, that they bite together but the sausage remain in between. Alright, so this is a condition, right, which was first described by Mizrahi in 1978, then followed by Moyers, Shapiro, as well as Beckman. Alright, so but they only describe a teeth condition. But what we want to explore further is that what is the cause of that. So say if we have a patient who presented in this way, which is an anterior open bite here, now what we need to do is that we take a posterior anterior skull x-ray, is what we call a PA skull x-ray, and with this x-ray we will then superimpose with the photograph of the patient, and so therefore we know the exact positions of eye, nose, teeth, chin, and the spine. So with the computer analysis, right, we are able to know whether the source of this problem is due to skeletal, which is the jawbone, or dental, the teeth, or the soft tissue origin. Yeah, so we also take a lateral ceph here, that means an x-ray with a lateral cephalometry, and we also analyze by the software with the AI. And the AI will then help us to match the relationship of the teeth, the lids, as well as the lower jaw, upper jaw, and the temporal mandibular joint. So from here, the computer will give us a series of the figure, right? So, and this is the x-ray analysis traced by the AI. So with these figures that we derive here, that we are able to analyze, first of all, the overall impression, that is whether this face belongs to a long face, meso face, or the short face basis. So if it's a long face, right, what's our definition to a long face is there, right? We define it with the chin point here, we call the menton, alright, to the maxilla, and then to our nasion, which is our forehead here. And a normal proportion should be 55%, but in this case it's 57%, so which means that it's a jaw-based problem. And the reason for this jaw-based problem is we have to check further. Right, so we check the upper jaw relationship here. The upper jaw relationship, the SNA means the upper jaw with respect to the cranial base, the brain. So it's 81, which is a normal maxilla. However, the upper teeth is 128, which is actually a procrine, meaning there is a protruding upper teeth. So therefore, what it tells me is that upper jaw is normal, but however, the teeth is protruding. Now, what about the lower jaw with respect to the cranial base is that, right? The lower jaw is actually protruding. So we have a big lower jaw, alright? And we also have a protruding lower teeth also. So therefore, in summary, the problem of this patient's anterior open bite is actually due to, first, is that it's a teeth procrustation. Alright, second, upper jaw is normal, but lower jaw is actually protruding. And third is a growth rotation, that this jaw rotates downwards. Fourth is a long face. And then what's the fifth factor? It's a tongue thrusting swallowing. So as you know that the tongue will go up in between here as a thrusting behavior, so the tongue will prevent the teeth from touching together, and as a result it also affects the lips from sealing together. So we have a lips not able to close, the tongue get into the way such that the teeth are not able to close, so it forms a anterior open bite problem. Yeah, and this will also result in a mouth breathing problem. So as we know, the air enters from the nose here, go through the sinus here to warm it up, then after that it goes to the larynx to go to our lung. But if you have a open bite cases, then the patient's nose usually will be obstructed, and then as this is open, this will offer less resistant pathway for the air to open and go to the lung. So that's all. This actually results in the anterior open bite. So we call this factor is called etiological factor. That means the cause for this problem. So now, how are we going to solve this problem? Having analyzed the cause of the problem and then understand the nature, so we then now have to plan how to solve this problem. So we use this Invisalign, the clear aligner technology. As you can see, it started from 0 all the way to 38 aligners. So with these 38 aligners, right, it progressively bring the teeth down so that they lock together. They also make the teeth upper and lower coordinate together and centralize the midline. So this was the beginning, and this is the predicted outcome. And as you can see that the tongue is very big and in between here. So now, this is what we predicted with the treatment plan, and this is the outcome. So the outcome of this treatment is that before and after. So you could see that we bring it down, and what we actually predicted is actually what we see here. And so this is actually showing that the teeth are actually closing together by the photo progressive morphing here. Right, so with this we want to explain to you that the digital technology using a clear aligner system is not just a clear plastic. It is actually an AI assisted digital technology, and also with the x-ray, with the diagnosis, and with the doctor's expertise in managing it, we then come up with a solution. And this solution is actually translated into a prescription, and with this we are able to make the patient just wearing this clear aligner and then deliver the expected result. So today is a simple sharing of Anterior Open Bite, and if you like my video, I welcome you to like me and share my video. And if you have any question, please actually write your comment and I shall reply them also. So thank you very much and good night.